All right, welcome to another episode from the Clinical AI Academy Journal Club. This is the eighth episode, actually, and today we are joined by Alastair Howcroft, the first author of the meta-analysis we discussed last time. Many thanks, Alastair, for being here with us to talk us through your ideas and findings on chatbot empathy. So, short introduction to the AI Clinical Academy. We aim to build AI literacy in healthcare by providing high-quality open-source educational transdisciplinary content focused on AI, artificial and neuroscience, medicine, psychology, philosophy, linguistics, trying to bring people together and start this discussion. We invite you to join our open discussions, shared exploration, and reflective practice. A very warm welcome to you, Alistair. And please go ahead and tell us a bit about yourself and share your screen with us.
Okay, so thanks again for inviting me and your video on my paper. I watched it. I very much appreciate that. I'm currently a PhD student at the University of Nottingham. I'm looking at artificial intelligence and feeling very broadly. The recent paper I've done was looking at perceived empathy of AI chatbots versus human healthcare practitioners. I'm going to share my screen and do this presentation that I mentioned. For some background here, it's been shown that empathy can improve outcomes like reduced pain, reduced psychological distress, general improved patient satisfaction. So if a healthcare practitioner, like a doctor, is empathetic or empathic, the patient is more likely to be satisfied with their care. And if they're in pain, they might have reduced pain. And its absence can also cause harm. So if a practitioner isn't empathetic, it can actually cause worse outcomes for the patient. For example, they might not adhere to medication, etc. So the issue lies in the fact that artificial intelligence is being increasingly used in healthcare. For example, in the NHS, talking therapies, there's a chatbot called Limbic Access. And according to their website, it's been used by 400,000 patients now. So that's quite a lot. And until now, there's been no synthesis on the studies that have compared perceived empathy of AI chatbots versus human healthcare practitioners. So we don't know whether AI can leverage the historical benefits of empathic healthcare that humans have. So if the AI chatbots were not very empathetic, that could be pretty bad for patients if it means that they're not going to sort of adhere to the sort of medication regimes or adhere to doctor's advice, etc. So this review compared looked at all the studies in the world that I'm aware of, in English at least, that compared the empathy of artificial intelligence-based chatbots versus a human healthcare practitioner. So in terms of the research gap, many existing reviews focused on diagnosis, efficiency, or accuracy. None of them have looked at empathy. So we needed a synthesis of the comparative studies between AI and human healthcare practitioners. The aim was to see whether chatbots can be perceived or are perceived as more or less empathic than human healthcare practitioners. And we conducted a meta-analysis where feasible, so where the studies had quantitative data which we could synthesize in a meta-analysis. We did that. We searched multiple databases, as you can see here. The studies that were eligible to be included were large language models, and we included any human healthcare practitioner, so whether that was a doctor or nurse, etc. What we included were simulations or fake, or not necessarily fake, but interactions that were sort of not genuine. For example, a researcher might have posed a made-up healthcare question to an AI chatbot and a doctor, and they were excluded. We only looked at real healthcare interactions or data that came from real healthcare interactions because we wanted the study to best reflect what happens in real life scenarios. We excluded rule-based systems. Artificial intelligence is quite a broad term. We didn't want to include studies that were rule-based, as, for example, an AI system that just operates on a strict set of rules, like if X and Y. That wouldn't really make sense. So we included just large language models, like ChatGPT. We used RevMan to do the meta-analysis, and we did a random effects meta-analysis. So we found 15 studies. 15 studies compared the perceived empathy of AI chatbots using large language models versus human healthcare practitioners. They were mostly using ChatGPT. We had multiple specialties: dermatology, oncology, neurology, mental health. So this systematic review wasn't just specific to one speciality. It looked at a wide variety of different specialities. In terms of how they evaluated empathy, The studies used Likert scales typically, so they would ask people on a scale of 1 to 5 or 1 to 10, how empathic did this response feel to you? One of them used a validated scale called CARE, and all people rating the responses were blinded, so they didn't know whether the response was from an AI or a human practitioner, which is important. I'll get back to that probably later if I remember. So, 13 of the 15 studies reported that AI was statistically significantly perceived as more empathetic or empathic than the human healthcare practitioner. The only specialty where that was not the case was dermatology. So the two studies that didn't find that AI was rated as statistically significantly more empathetic were situated in dermatology. Overall, we found a standardized mean difference of 0.87. This roughly approximates to a 2-point difference on a 10-point scale. So we've learned that on average, an AI chatbot is likely to be rated as 2 points higher on a 10-point empathy scale. We also found that in a head-to-head matchup, an AI chatbot it has a 73% likelihood that it's going to be perceived as more empathic than a human healthcare practitioner in a head-to-head matchup. And this was statistically significant, as you can see by the p-value here. So limitations. One of the limitations I just mentioned was the fact that the raters were blinded from whether the responses came from AI or the human healthcare practitioner. And this matters because it's been shown previously that once people know a response is from AI, they perceive it as less empathetic because then once you know it's from AI, you kind of know that it doesn't feel the same. So future studies should look at instances where the participants know that the response is from AI and human, because in a real life scenario, you're likely to know that a response is from AI, or at least you should do if we have transparency. They were in text only evaluations. The only one that wasn't the participants did communicate through voice. However, the actual people who rated the empathy only looked at the transcript, so it was all based on text. This is important because it means that we lose voice or visual cues. For example, if you saw a doctor, you wouldn't just be listening to what they were saying. You'll be looking at how their body language. You know, if they're nodding, they're leaning forward, etc. Because these were AI chatbots, it was obviously just based on text. So humans may have an advantage in person once they have these nonverbal cues. Many studies relied on proxies, so real patients weren't rating the empathy. The people who were actually receiving the care weren't rating it. Some of them were patients, but they weren't the patients actually receiving the care. For example, a patient will receive a message, and then they'll get another group of patients to actually rate the empathy between them. So it would be better to have the actual patients receiving the care to rate the empathy. And the studies were very different. There were a wide variety of specialities. So we can't for sure go and say that, for instance, AI chatbots are more empathetic than all rheumatologists, because there were just 1 or 2 studies were in rheumatology. In future directions, we should probably investigate clinical impact of this, because although we've determined that AI is frequently perceived as more empathetic than human text-based interactions, we don't have clear evidence that AI-led healthcare can improve patient outcomes, like adherence. So that'll be something to investigate. It also has clear, obvious implications for workload for healthcare practitioners. For example, a promising avenue could be AI to create first drafts of administrative questions. Another area for future work would be to investigate multimodal AI. Recent evidence suggests that multimodal AI can actually read facial expressions to the same degree of accuracy or even higher than humans. So if we incorporated AI that can not just see the text that you say, but also looks at your facial expressions, may be perceived as even more empathetic when that happens. And then we could do comparisons with humans in more face-to-face interactions. That's it. You want to ask me some questions now?
Fantastic. Thank you for this excellent brief talk and the work. Let me see. Okay, so yes, I do have some questions. We have time for that. That's great. I think you touched on the first question, which is the limitation of how those models are rated. Like, how are they rated on for the empathy, like on the Likert scale? So, and that patients are not, doing the rating themselves, but like it's like a proxy. And that in future directions is like have more real world. So probably what you mean is something like prospective, external, prospective studies where it's randomized or controlled trials, maybe, right? So what would the future to address this issue of this limitation future studies would be, for example?
So one study was a randomized control trial. However, still, what happened is that the raters were still proxy raters. They weren't the patients receiving the care themselves.
Mm-hmm.
So people collect the responses from AI and human practitioners and rate them. That doesn't necessarily undermine these findings or suggest that AI isn't as empathetic because they weren't rated by the patients receiving care. It's
Okay.
just it would be a valuable research direction to conduct a study where the patients themselves, actually the ones who received the care, rated the empathy rather than getting somebody else to go and look at the message you received and saying, was that empathetic or not? Because it may, I don't know to what degree, but it may influence how empathetic you feel a response is if it was specifically given to you, rather than if you're looking at a response given to somebody else.
Mm-hmm. Okay. All right.
So that,
That makes sense. Because I mean, you want the patient to, because I guess, but like the rating of the empathy of the human doctors was also done the same way, right?
same way,
So
yeah, yeah.
so that also is something to keep in mind. That also proxy raters, I mean, did the rating of the human doctors, right?
Yeah, did rating of both the
Mm.
AI and the human.
Okay. Okay. Yeah, that's a limitation. So, all right. So the next question would be, where did the AI learn to be empathetic? Like, like if you're training the AI, you're training it on responses from humans, basically on data sets that maybe on Reddit or like on.
Yeah.
How did it
So
become empathetic more than doctors? Where did it learn that from?
well, there's quite a few steps for creating an empathetic reply in large language models like ChatGPT. Um, a key part, well, obviously, it's trained on a wide variety of text from the internet. But one of the key areas in which it learns to be more empathetic or be perceived as more empathetic is reinformance learning from human feedback. So when a large language model's responses like ChatGPT is trained, what they'll do is they'll get people to go and rate the replies from the chatbot, and then they'll give them a lower score if they don't like the reply and a higher score if they do like the reply, and that will include things like its perceived warmth, um, how empathetic it feels. If it's talking in a sort of demeaning manner, people will rate it lower. So through this process of assigning these scores, for example, you might give it 1 if it doesn't seem very empathetic, or you might give it 5 if it does seem empathetic. And through this process called reinforcement learning from human feedback, the AI learns to create replies that seem more empathetic. So in a way, through this training process, it's effectively punished for creating responses perceived as cold or unhelpful, and it's rewarded for responses that seem as empathetic. Through this process, you get chatbots like ChatGPT where people like the replies from it because they feel empathetic. Another area to mention is the fact that the chatbots created longer replies than human healthcare practitioners. And some studies also have investigated the correlation between longer replies and perceived empathy. And when the replies are longer, people perceive them as more empathetic. And that's an interesting thing because I think some people remarked before saying, well, it's kind of unfair because AI chatbots could write longer replies, and the human healthcare practitioners are sometimes more time constrained, so they can't write these longer replies. So I would argue that's the benefit of the AI chatbots is that they aren't time limited, so they can write longer, more helpful replies to patients. Whereas a human healthcare practitioner might be very time constrained and they write a very brusque and short and sometimes unhelpful message.
I get it. Okay, so I think this is a very important field of study to understand because what we're seeing that patients or like everyone is using chatbots for their all-day questions, including psychological questions, and to understand how this interaction impacts the health of the outputs is very important because this is, I guess, what's happening next in medicine. But so I have. Like you mentioned, like being perceived. You mentioned the word being perceived more empathetic.
Yeah, I'm careful with that word
Yeah, I
because some
noticed.
people, yeah, so
Because
many people say, yeah, well, it's not empathetic. So to get around it, you have to say, well, it's perceived as empathetic.
right, because the studies, I guess, the formulation, the way the I don't know, at least the way the studies are communicated with after being published, it just says AI is more empathetic than humans, and then this gives the impression that AI like is has like understanding
Hmm.
of what and what the pain, for example, like
Hmm.
and of others, of humans, like has an understanding of the feelings. And so, would you tell us more what you think about this perceived
Well,
empathy? And
well, it's a very philosophical argument that some people make. I view it in terms of, if you look at it, empathy is typically broken down into cognitive empathy, affective empathy, and compassionate empathy. Cognitive empathy is when you can understand somebody else's perspective, right? You don't necessarily have to share that. You don't have to share their feelings. You can just understand why they feel the way they do. And I would argue that AI, in that sense, is being empathetic because it doesn't have to feel it, and it's not feeling it. Um, but it can understand, and it does understand your perspective, and it's trained on so much information that it arguably, I think, can understand your perspective in a way that no other human can. Things obviously get different when you talk about effective empathy, because that is when you actually start to share other people's feelings, and AI can only simulate that. Really, obviously, I mean, at least
Mhm.
currently, AI doesn't have that sort of um, autonomous, conscious experience. So it is actually very excellent at simulating effective responses. You'll say, I'm sorry to hear that. That sounds very upsetting. Stuff like that. Um, And the counter argument I would say to many people saying, well, if it's simulated, therefore it's fake, therefore it's rubbish, who cares? First of all, what really matters is that people perceive it as empathetic, because then therefore they will benefit from it. It doesn't really matter if you go into the whole philosophical argument, that isn't really going to help patients. Um, and also, many practitioners have to go and simulate effective responses. Obviously, it will be too demanding to have to keep on having to hold this emotional load of other people's feelings. So you have to sort of fake it or simulate it to some extent, much like the AI is doing. And then the third part of empathy that people usually break it down is compassionate empathy, which is usually a combination of the two other cognitive and affective empathy, where you're sort of driven, you feel like you want to help people. Um, that's more confusing. I would again just say that that's obviously simulated because it requires effective elements. But altogether, I think that it's obviously best to go and say simulate empathy because empathy is a holistic experience. It's not just cognitive, affective. It's not just cognitive, sorry. It's also the affective elements. So it can either implement or simulate many aspects of empathy.
um, yeah, thank you for expanding on that. Well, that reminded me that as doctors, like you get trained on how to talk to patients. Like
Hmm.
it's kind of post post medical studies, like post the basic knowledge that you
Hmm.
understand about physiology, anatomy, diseases, pathology, everything. Then once you're in going to the clinic, you get like post kind of it's kind of similar to the large language model, kind of in a sense that after that you need to get trained on how to communicate in difficult situations where you're understanding what the patient, but still delivering the medical advice properly, and that would guarantee compliance, for example. Or people don't like the word compliance anymore, but like that they are they stick to the treatment plan, that the patient understands, so empathetic kind of. And what you mentioned about faking it is you learn it. It's kind of like you're
It's a
acting
performed skill. Yeah, yeah. It's like
because
acting. Yeah, it's a
uh,
learned, performed skill.
some don't acquire it. Like and they're not kind of like large language models. You have other humans that are sitting and they're with reinforcement learning. They're trying to like human feedback learning. They're, as you mentioned, they punish kind of the large language model when so it acquires it, luckily,
Mhm.
kind of post training. Um, and but kind of like I don't know if it's fair to compare like the human to the machine, and this might be not only in the empathy domain, but like even accuracy, even because I feel like we're creating machines that might be better than us. That we're demanding so much from the machines that we would not expect the humans to be as good as the machines. Like a human error in medicine, for example, is a huge, like you would accept a bigger margin, I guess, than from a model, a model, an AI model that is in medicine in accuracy. So, and then once you compare them, I guess, like you mentioned, short answers from physicians. Physicians don't have time to even give those questions. They give those answers. So you're comparing like it's not a fair comparison to the human kind of. What do you think about that?
Hmm. Um, I agree that it's not necessarily fair for human practitioners to go and do a comparison saying you have, say if there was an experiment, what you said, you have 1 minute to reply to this patient, and and AI was given 1 minute, and it spat out a response in 3 seconds or less, and the
Especially
human,
in text, right?
yeah, in text, and the human obviously can't can't begin to go and match that. It wouldn't necessarily be fair. However, that I think just illustrates the importance of how we're going to use AI in healthcare. For example, maybe we should look at the things that human practitioners can do very well, but the AI can't do very well yet.
Mm.
And maybe we should let the AI take on more of the administrative burden that arguably it can do better and faster than the human healthcare. So one way to do that could be, for instance, to go and create drafts to patient queries, and then the human practitioner then reads that before sending it off. And that
Saves a
can
lot of
save a lot
time,
of
right?
time.
Mm.
Yeah.
Uh,
Obviously, there are many things that humans can do that AI can't do or may never be able to do. Um, I don't think we'll ever reach a point where we have a humanoid robot that can perfectly encapsulate the presence of an empathic human healthcare practitioner. Um, so, in face-to-face interactions, I think a human is always a good human, a good empathetic human, is always going to beat even the best humanoid robot if we ever reach that stage. Um, that's not to go and say that humanoid robots or robots in healthcare won't be excellent, but I think there'll always be instances where a human practitioner will win.
Great point. So if you had to choose, like, I guess we're coming to an end of the discussion, and I would have one last question to you while you're here with us. If you had to choose, like let's say first question is you have a human doctor. If you would you want your human doctor to be accurate or empathetic if you're a patient?
Hmm, good question. I think I think you'd obviously always want them to be accurate over empathetic, really. I mean, if you look at it, like someone could be very empathetic, but they could give you wrong information that could have a devastating impact on you. Whereas if someone gives you accurate information but in a very cold way, that's going to be better for you, I think, objectively. Um, I think it depends if it was more nuanced and you said um, a doctor who was 100% accurate versus one that's empathetic, but sometimes they may not have the uh, the information that's quite as precise or accurate as the other practitioner, then it would become more interesting because, as you say, you use the word compliance, but you're not supposed to use it anymore. But with adherence to medical advice, I think most people are always going to adhere to it more if it's told in an empathetic manner. And
Mm,
you're obviously going to, and it depends on the situation you're in. If you're in something, if you're in a really sort of difficult medical diagnosis, it can be really upsetting to not receive that in an empathetic way,
I see.
and
And
that
would
could have really bad impacts on you. So I think, it's a good question.
so does the same apply to like an AI let's say I call it an AI doctor, an AI or a robot? Would you
Um,
want your robot to be accurate or empathetic?
hmm. Well,
But
I think with an AI, it's very much different because you would hope that introducing the ability to be empathetic wouldn't detract from its accuracy, because you can control for that, unlike a human, you can't necessarily like change the system instructions to be empathetic. It's just how people are typically. Um, so I think you would prefer to go and maybe lose some accuracy by introducing empathy.
Mm-hmm.
That was a limitation I mentioned in the paper, is that I didn't actually look at the accuracy of the AI chatbots. I was just looking at the empathy. It may be, maybe it may slightly detract from the accuracy if you sort
Okay.
of tell the AI to be empathetic. Maybe depends on how you evaluate accuracy. But if you take away some of the sort of strict medical information, replace it with some, not fluff or filler words, that's the wrong word, but some words that indicate empathy, you may detract from that slightly. But obviously, that benefit far outweighs the potential loss you might have from what you might call accuracy.
Mm. It's interesting that you mentioned that that might not really deter from or decrease the accuracy with the robot, but on the
Hmm.
human, you have this limited kind of capacity of like balancing both. Obviously, you
Yeah,
want,
you have
want
like the
someone
cognitive load.
who's empathetic and accurate, and
Uh-huh.
you know, so but maybe like then the combination which of like AI and doctor would like be augmenting each other, like very accurate AI and a doctor that
Yeah,
is
maybe we
empathetic.
should let the AI take over the sort of accuracy diagnostic sort of stuff, and let the humans take over the human stuff.
Do you think that would be like the future kind of like this is how if you had to design like the optimal situation from your point of view like 5 years down the road, knowing that technological advancements is going on the way it's going and it will keep like exponentially going, and you say okay, how would you uh, have the optimal situation like.
Um, I think part of the issue is that many human practitioners aren't empathetic anyway, and they're not going to be. So if you
Mm.
go and say, okay, we're going to let humans do the part that requires empathy, unless you like,
So they're bad on accuracy and on empathy.
sorry?
So they're
Well, not
performing
all of them. Not all of them are
like
bad on empathy, but
some.
some are. So the point is, I'm saying if you're going to say, okay, we're going to let AI do the accuracy and let the human practitioners do the parts that should be empathetic, I don't think that would be necessarily successful because not all practitioners
Mm.
are empathetic. I think that could backfire slightly. I think I am a lot of medicine's going to be virtual now, especially with chatbots. So I think text-based communication will be something where AI can excel quite a lot on. In terms of in the future, definitely in person, humans will be better than talking to a chatbot. So for in-person things, definitely humans. Um, I think the best like model I could think of now is um, humans use AI, as I say, to help with the administrative burden, paperwork, etc. And then that means they have more time to actually talk to patients in person. And then that can help with the more human aspects of care, and then letting AI take on the work
Mhm.
that's more perceived as a burden.
I think there comes to my mind like one study I came across some time ago, um, that sometimes just going to an empathetic doctor, the placebo effect of
Mm,
even if they don't do anything to you as a
mhm.
patient, just going to someone who listens to you, listens to your problem, and then helps you, like with your symptoms and with healing. So
Yeah,
maybe
that's
that's
definitely an
this.
aspect. Yeah.
Maybe that would be interesting also to look at. Like, is there like a placebo effect of chatbots of patients looking like talking to once we get to the studies that you're talking about, like seeing how patients are interacting with chatbots and um, is it like helping as a placebo pill kind of? I don't
Yeah,
know.
it's definitely been compared to that before. Like I mentioned,
Yeah,
perceived empathy has been shown to reduce pain. That has been
yeah,
compared to a placebo, like a placebo pain relief. It is a similar effect, and it has been compared to a placebo before.
right. So with a chatbot, right? Like,
Yeah,
okay, all right. Mhm.
yeah.
I,
So arguably you could say it is kind of like a placebo when a chatbot talks to you nicely. It
all
makes you
right.
feel better, and it's not necessarily
Yeah,
giving you like,
super
medical
interesting.
treatment. But
Very super interesting topic. Very important. I wish you all the best in your PhD journey. You're in a good start and a very important topic. And thank you so much for your effort, for being with us, for taking the time, and wish you all the best. And maybe we see you in a year and meet with you with new publications. I hope.
yeah, it was great. Thank you for having me.
Thank you. Have a great day.
You too. Thank you.
Ciao.
Bye.